Hi everyone, welcome back to my YouTube channel. In last video I discussed about asthma and its causes and symptoms. In this video I'll be talking about the treatment. Presently there is no cure for asthma. It only has symptomatic treatment. I know how depressing it can be when you have to deal with a disease all through your life. That is, there is no cure. Maybe you are recently diagnosed with asthma, or your friend, your child, or a family member is recently diagnosed with asthma, and that can be depressing. I know, I understand. But you have nothing to worry about. Instead of sitting, depressed, crying, and then see that the life is useless, what is need of living, instead of suffering with these diseases and depending on drugs all through my life, it's better I leave myself to die. No, darling, that is not an option. You can live a very normal life. Asthma is not a death sentence. Many people suffer from asthma and many of them are living normal life. You just have to put your asthma under control. You just have to work with your doctor to draw a treatment plan for you, asthma treatment plan for you, so that you will live a very normal life. So I'll be discussing the different drugs used and also give my advice and some lifestyle changes that you will take to put your asthma under control. Giving up is not an option. People do go asymptomatic, like you barely know that they have asthma. Like the attack will occur once in a while. So it depends on how well you control your asthma. Or maybe you've been having asthma for years and then you are at the point of giving up. You have tried so many things and you are tired. You feel like this life is miserable. Please, don't give up. Just watch this video to the end. You might pick one or two things that you can incorporate and try it out, which might work for you. The treatment of asthma are this. First and foremost is that you have to get rescue inhaler, number one, which is short-acting beta agonist. This is used during the attack. This drug is used during the attack because during the attack, the airway is constricted. So this short-acting beta agonist will dilate the airway and open it up. It acts within minutes. So you get this inhaler right away and make sure you go with it wherever you are going. Don't leave it and then step out because you can encounter your trigger anyway. So get your rescue inhaler first. Your doctor will give you your rescue inhaler first before they will engage in any other treatment. This short-acting beta agonist does not control the asthma. It's just used for symptomatic relief that at the spot of the asthmatic attack. Another inhaler used is anticholinergic, ipratropium bromide. So this short-acting beta agonist like salbutamol or terbutaline are mainly used, or ipratropium bromide, which is anticholinergic drugs. They are meter-dose inhaler used to rescue someone during the asthmatic attack. The maintenance drugs used are 1. Immunoglobulin E neutralizer like omalizumab, reslizumab. These two drugs are mainly used. This drug will neutralize the immunoglobulin because this immunoglobulin is found much among other immunoglobulin in the blood, and they are the identifier of foreign matter, and once they identify it, they will trigger or activate other immune components to start reacting. Another class of drug used is anti-inflammatory drugs like glucocorticoids, cortisone, flinisolide, deflazacort, beclomethasone dipropionate. So these are anti-inflammatory drugs. They will inhibit the process of inflammation because asthma is an inflammatory condition. Another class of drug used is mast cell stabilizer such as ketotifen, chromoglycate. These two drugs are mainly used. This drug will stabilize the mast cell. Mast cell is an immune component, and when this mast cell is degranulated, it releases inflammatory mediators like histamine, leukotrienes, and other inflammatory mediators. Another class of drug used is the one that will neutralize this mediator if they are released by mast cell, such as leukotriene antagonists like montelukast, zevalukast, antihistamine, and platelet activating factor antagonists like rupatadine. This drug will also control allergic reaction. And that class of drug used are long-acting beta agonists like formoterol, salmeterol. and also anticholinergic like pratropium bromide. If you have an asthma, you work with your doctor. They will draw a treatment plan for you based on your overall health, the severity of your symptoms. So don't try to practice self-medication if you are diagnosed with asthma or if you experience any of asthma symptoms. Get diagnosis first. Work with healthcare provider. If you don't have access to good healthcare provider, you can have a healthcare provider as a friend, just like me, so that they can direct you. Asthma is not what you just walk into the pharmacy and get any drug and start treating yourself. It requires a long-term treatment just to put your asthma under control. Because only when you put it under control that you can live a normal life. Otherwise, it will escalate and it will alter your daily activities. The severity will be much and it will alter with your daily activities. So don't allow that. Work with healthcare practitioner to draw a treatment plan for you. And once they have given you this medication, please make sure you stick to your medicine. Take them as you are advised. Don't take overdose. Don't miss your dose. Don't say, oh, I feel better. I'm tired of taking medication. Let me stop taking. Please take your medicine religiously. Because with time, you put your asthma under control that you can even go symptomless and will not require this daily maintenance dose. So apart from this treatment, I advise that you study yourself and identify your trigger. Different people have different trigger, like things that will cause the symptoms or the episodic attack to increase. And once you identify your trigger, avoid it. Try to observe yourself properly. Those things that when you encounter, it may be smoke, it may be smoke like cigarette smoke, smoke from cars, it may be pollens, it may be dust, it may be animal furs, it may be food, it may be any chemical that is very pungent. It may be anything. So once you identify it, you try to avoid it as much as possible. And if you can't avoid this trigger, maybe that trigger is present in your office or things you do encounter from time to time, you make sure you take your drug like the mast cell stabilizer or leukotriene antagonist before going to that place in order to help yourself. Another thing is, if you have asthmatic attack, maybe your asthma is triggered by exercise, try to avoid exercise, like engaging yourself in vigorous exercise. You can do little stretching or other minor exercise, but not vigorous one that will trigger. And also, if you have asthmatic attack, if you use inhaler, you should be fine, like within minutes. But whenever you've taken the maximum dose advised by your doctor and your symptoms is not getting better, try to puff like 8 to 10 times, but not more than that. Then wash yourself. If you don't get better, then you need to go to the hospital immediately. It will need an emergency attention from healthcare provider. So I will talk about the food that you should avoid if you're having asthma, because it's not necessary that avoiding this will help you get cured completely, but it will help you a long way, because there are some foods that increase mucus secretion and also cause irritation sometimes. So number one is dairy product like milk. People do report that once they quit or stop including dairy products or milk from their diet, they feel more better compared to using it. So I advise that you avoid milk and other dairy products. Avoid foods that cause gas like beans, cabbage, and carbonated drinks. Avoid processed food because they contain some preservatives that may trigger asthma, such as sulfite. Avoid beer, alcohol. Avoid wine as well. If you are a smoker, stop. Please quit smoking. And if you're asthmatic and you have someone who is smoking, make sure you don't stay with them when they want to smoke. And also, mind how you inhale smoke from cars. Avoid fried food and nuts like peanuts and other nuts. Avoid nuts and other nuts. And I will advise you incorporate anti-inflammatory food in your diet like ginger, garlic, turmeric, and other antioxidants. Include fish like salmon that contains high omega-3 fatty acid. This will help to fight your inflammation. Avoid any food that you are allergic to. Avoid any food or anything at all that you are allergic to. In case if allergic reaction. Avoid anything that you're allergic to. Don't even give it a second chance. Even if you like it so much, once you identify that you're allergic to it, or because you now have asthma, it triggers your symptoms, avoid it completely. It will help you. Don't go out without mask. That is, if you are going to encounter dust. In Nigeria, during dry season, there used to be so much dust everywhere because we don't have wood. So so if you are going out and you know you're going to encounter that, make sure you wear mask. If you don't wear mask, put it in your pocket so that in case you encounter it unexpectedly, you can just wear your mask and stop yourself from inhaling those dust or pollution. It will help you. Just take all the precautionary measures you need. And make sure you clean your house. Clean your house properly. If you have dust, in fact, if you can get rid of all sorts of dust from your environment, do it. Don't live in a dirty place because it will not help you. Living in a clean environment will be a very good option. Clean as much as you can. And if you are doing house chores like cleaning dust, wear your mask. Don't open your nose, because even those with healthy lungs, if there's kind of clean up they'll do, if the place is dusty, they'll end up coughing and having running nose, let alone someone that have unhealthy bronchi. So cover your nose when you are cleaning. There's home remedy some people do practice. Number one is drinking clove. Like if you get clove bud, you can boil it and drink it as tea. Or if you can get the powder, you can drink it as tea, incorporate it. Maybe you can make it even your morning tea. Another one is licorice bark. If you can get the powder or the bark like that, you can boil it and mix with honey and take. Another thing is ajwan. Ajwan, you can boil it and then inhale the vapor that will come out from it. Another home remedy is mustard oil mixed with camphor, and then heat it up and massage it on your back and your chest. People also advise respiratory exercise, like where you have to sit straight in a good position and then take a deep breath and out. There are different breathing exercise technique which the physiotherapy can help out with if you are trained on it, because this will help to strengthen your chest muscle. It's just like someone who is doing exercise, like carrying weight. At first it will be difficult for them, but with time, even a heavy weight, they can easily grab it. So also, if you are doing exercise, you strengthen your chest muscle, so breathing will be more easier for you. So if you stick to a treatment and try out all these things I listed out, while working to put your asthma under control, don't be in a haste. Be patient. Don't just practice one or two or one of this method for 2-3 days, and then because it does not work magic for you, then you say, oh, this one does not work, let me try another one. Give it time, from 1 week to 1 month to 3 months to 4 months, and then observe yourself, observe any changes, and whichever one that works for you, stick to it. Don't compare yourself to others. Don't say because, oh, this person is having asthma, they are eating this, they are eating that, and they are okay, me too, I will do the same. No, our body are different, so try to figure out what works for you and stick to it. If you are a mother or a boss to someone who is an asthmatic, please help them out. Don't overstress them. Allow them to have rest whenever they need it. After the attack, these people used to have to be very, very weak. So allow them to rest and become okay before they can engage in any other strenuous work. Help them out. And also, if you happen to meet someone who is having asthma attack, don't run away. Just be there with them. It is advisable that you stand up if possible, or sit down, sit straight. But lying down is not an option because that will worsen the symptoms. Try to calm them down, even if they can't talk to you, because during this asthma, they will barely talk. It's also someone who can breathe properly that will talk. If you can't breathe properly, you cannot even talk. So during this asthmatic attack, they cannot talk. Try to calm them down. Don't run away. Asthma is not an infectious disease. Help them to get their inhaler right away. And if there is no inhaler, just be there with them. Help to calm them down until this attack is over. So the preventive measure you can take is 1. If you have any respiratory disease, be it rhinitis, or sinusitis or any or if you have like rhinitis, sinusitis, or you have allergic reaction where you always have flu, running nose, always sneezing, try to put this under control. Or maybe you have bronchitis, that is inflammation of the bronchi. So try to put that under control. You don't allow it to escalate to asthma, because most of the times all these respiratory diseases can lead to asthma. Incorporate anti-inflammatory food in your diet. Don't wait to be sick to start practicing it. Avoid anything that seems to increase mucus secretion in your body. Avoid any food you are allergic to. Because if you don't tackle these minor things now, like sinusitis, rhinitis, bronchitis, or allergic reaction, if you don't tackle it now, it might result in asthma, especially if it have to do with airway. Generally, anti-inflammatory foods or food that is antioxidant in nature will help to fight free radicals that might result in inflammation, and also fight off other foreign matters that can irritate our airways. If you know this asthma, just like I explained in the other video, if you know the name in Igbo, please comment on the comment section below. And since it does not have cure allopathic like English system of medicine, if you know about the cure, if you know that this asthma have cure in any system of medicine, like with proof, please comment on the comment section below. And also, if there is technique that is working for you, maybe you're asthmatic and there is technique that you've been using and it's really working for you and it have helped you so much, also comment on the comment section below so that others will learn, and let's help each other together. Thank you for watching and do have a good day. Bye bye.